Regionally, the Caribbean Media Corporation CMC reports that Caribbean American Democratic Congresswoman Eva D. Clark has collaborated with New York Congressman Michael Noller in leading a bipartisan bicameral letter signed by 98 of their colleagues to United States Secretary of the Department of Homeland Security, Kristi Noem, urging DHS to grant a health care sector exemption from the new $100,000 fee on employers petitioning for the new H-1B visa. Clark, the daughter of Jamaican immigrants, represents the predominantly Caribbean 9th Congressional District in Brooklyn, New York. She also chairs the Congressional Black Caucus. Worsening workforce shortages across all healthcare professions are significantly diminishing access to care in rural and urban communities across the nation, the letter says. According to the Health Resources and Services Administration, nearly 87 million Americans live in areas federally designated as lacking enough medical professionals to access the community's health care needs. Physician demand could exceed supply by up to 86,000 in the next decade, and clinical laboratory science programs are educating less than half the number of clinical laboratory professionals needed, the letter adds. These shortages cannot be filled by the domestic workforce alone, and projections will worsen if healthcare employers cannot continue to recruit and retain international healthcare workers. Imposing a U.S. $100,000 fee for new H-1B visa petitions will exacerbate hospitals' existing staffing challenges and could push chronically underfunded hospitals to their financial brink, the letter continues. If these hospitals cannot petition for the new H-1B visas to address their staffing needs without also having to pay this fee, it will further damage their financial viability. The lawmakers say that critically needed open positions will simply go unfilled, leaving rural and high-poverty urban areas without adequate access to care. We strongly urge you to exempt the healthcare sector from this burdensome fee, they say in their letter. The letter was signed by 100 members of Congress and supported by scores of healthcare organizations and associations across the country.